Hey guys, it's Dr. Emer, and we're doing one of our favorite treatments today here in West Hollywood, male facial sculpting. And we're going to use a combination of a few fillers because we've already done some building in our building process, and all you guys online have been asking him out ever since we did these treatments. I'm telling you, more DMs than I've ever seen asking one of our patients out. But that's because we've done really good at taking care not only in skin but also building out contour. We've done a little bit in cheek, a little in jawline, and a little in lip just to soften things. Now we're going to make it even better by enhancing the jawline a little bit more. It's the go-to treatment right now for Hollywood celebrities and a lot of my male clients. Males want to have that more squared off 90-degree angle in the jawline. My females tend to want more slenderization and more soft contouring in the neck. So we're going to start using Radiesse. You guys can see that here. Calcium-based filler. This is a thicker filler that's typically injected on bone, but when we do the jawline, turn a little bit this way. We're going to follow that 90-degree angle. We're going to go right at the edge of that jawline, right at the edge. We're just to do a little depot injection first. I want to see how it builds. I want to see how it structures, because it's going to make, we've already built a little bit here before, it's going to give a little bit of a width. For men, we do it a little different than we do with females. With females, we do less of this large sort of masseter look. We do more of a slenderized look. With the men, we really want to build this out, and we're going to do massage technique in a second. It always looks a lot bigger than you think when we initially do it. And then the swelling goes down and everyone says, oh, I wish it stayed that way. So we're going to do right now just a half a syringe. We're going to have my assistant come in and do a little Q-tipping. Are they asking any questions? Are they saying anything?
How long does this filler last?
So the Radiesse filler lasts about a year to a year and a half, which is great for giving structure and building. We're also going to go to the areas that men tend to notice aging a little bit more, especially when you work a lot and you're busy, type A, you're always traveling, the under eye area, which we're going to use a little filler to do there as well. Have them turn to the side. We're going to follow that 90-degree angle again. We're just going to do a little bit in sort of depot injections to start. You can see here I'm kind of depoting just a little. We're going to build that out. Okay. Bite down a second. Good, relax. We're going to follow his natural movement here. I'm going to build that structure just a little bit. Again, I'll probably do a little softening as well on the chin, even though our focus is mainly the jawline today. We want to balance everything.
Which areas of the face is this filler best for?
Well, this filler can be used for contouring and building structure. Temple area, jawline, chin, cheek are typically the way to go. It's one of the FDA-approved hand fillers, just so you guys know.
And where are we located?
So you guys know we are in West Hollywood, California, Beverly Hills, Los Angeles area. Always doing advanced, fun, cosmetic treatments. So we're just going to sculpt a little bit. It's very artistic, like I said, you guys. It's going to look a little bit more. Okay, go ahead and Q-tip them. It's going to look a little bit more done now. I'm going to let that settle a second, move over to just doing a little bit, because we're going to do a little to the lips, so I'm going to do just a slight bit on the chin just to balance everything. Great, look straight ahead now. Men tend to, when you have a wider jawline, we typically want to keep a little bit wider of a chin. So even though our main focus is this is jaw, I really want things to be balanced out. So we're going to do just a small bit here, right on the bone. Like I said, it builds structure. Nice and soft. Not much, just a very little bit. Okay, hold on, go to the other side. it a second. Just a little bit so you guys can see blending of the jaw. Go ahead. Good. Now I'm going to go and do the under eye while that settles a little bit.
Do we offer any kind of package deals for facial sculpting?
Yeah, usually we do when somebody comes in. It depends on what they need. We can customize it, add some syringes. Because today we're doing. They're signaling me. No. Today we're going to do a combination of things. So by adding those things together, we can package what we're doing for him and get more out of it. So turn a little bit here.
And a lot of people are just tuning in right now and they just want a quick recap of what we've done.
So we're facial sculpting using some fillers. We use some Radiesse on the jawline right now. Now we're going to go to the under eye area and do using Volbella. Now sometimes, I don't know why, a little bit harder to get the candle. There we go. And we're going to go all the way up into the eye. He shouldn't really feel that much actually. But we're going to use a very subtle amount of the filler here to just kind of lift the skin.
What does injecting filler into the under eyes help with?
So this helps with dark circles, also with that tear trough area, sort of the crease that some people start to see. He's been traveling a lot lately, so doesn't really want to look as tired. And so we're using the cannula to sort of make it less painful and also less likely to bruise. So you can see already if you look at the one side versus the other.
What is Volbella made of?
So Volbella is a hyaluronic acid filler, you guys. This is a little bit different than the Radiesse. That's a calcium-based filler. This is a sugar-based filler. So in men tends to not want to last as long, but it's much softer in look. So we don't need to worry about a hard look on his under eye. We want it to be soft and look very natural. The great thing about Volbella is it typically lasts about a year because of the technology. You can see the one side versus the other. Take a look. It also balances with his higher cheekbone. He naturally has the sculpted facial features. So now we're going to go into the other side and go right, same thing, right under, using the cannula into the tear trough, very small amounts. And I like to kind of blend it in as we're doing it, building the structure in this area, not doing a ton of volume, just a very small amount.
Injecting into the tear trough area is known to be like a very risky area to be injecting in.
Well,
what steps can people take to ensure that they don't have any complications?
Well, the key is, you guys know this is a risky area. There's blood vessels here. It's by the eye. It's a sensitive area. It tends to want to swell more. So one thing is, by using cannula, which we're doing right now, limits typically issues. You can see it's a blunt-ended instrument there. It's not that sharp, so the risk of bruising and swelling are smaller. Also, just going to someone experienced, also doing small amounts of the filler at a time. Do a little bit, wait a week or two, come back, add some more then at that point. Don't overdo it. Okay, good. All right, so we hold over there. Now we're going to work our way over to the lip. Now, the first thing I want to do is I just want to use a teeny dab right above the chin. This is the lower cutaneous lip area, right there. Because that blends the area three-dimensionally. It makes the chin blend into the lip and make all this sort of contouring and shaping much better. Also, I know our focus is his upper lip. I'm going to do a little pinch, but I'm still going to do just a little bit in the lower. Couple blebs in the middle, not much, very little, just to make that lower part be a little bit bigger than the upper. because that's, or his, you can actually get away with it being almost the same, because that's the natural proportions. He likes having a little bit of a pout, looks great. Now what we're gonna do is give a little more definition of his upper. So what we're gonna do for him is actually create a little bit of a column on both sides. And then he really wants this middle part to pop. So we're gonna go right up into that little middle portion and make it pop a little bit. Nothing too much in the sides. Let's focus on the middle. We're gonna do the same thing over here. We're just gonna make this middle part pop by going right up in there. Perfect.
Do you offer any injection courses?
Yeah, email pj@jasonmrmd.com if you're interested in any training courses. And then we're gonna do just a slight bit of pout on the side. Right now it looks a little swollen, and then it always goes down 20 or 30%. And people go, oh, I wish it stayed that way. But we want it to look natural. We don't want too plastic of a look. Okay. So we're gonna give him a little bit of the shaping there. Just a little bit more in this pillar. Just a little bit more in this pillar. And since this pillar is very soft, it's regardless of volume, it's going to look really natural. So then I have a little bit left over on some of the radius. So what I'm going to do is kind of fine tune. Even though I'm going to go a little bit wider here, I am going to do one dab in his temple. I know he didn't numb here, but we've done this once before, and this will kind of give him a little lifting in the brow, and also it's going to blend with the natural shaping of his high cheekbone and jawline now. So that's going to be there. I'm just going to kind of play around with what I have. I'm going to do that same thing on the other side, then add a little more to the jawline to finish it up. What's great about the Radiesse, you guys, is long term he will get more improvement because collagen will build. It's one of the few fillers where collagen actually does build.
Which other fillers are good for collagen
So building
production?
long-term Bella fill, which is one of our favorite sort of permanent. You look on YouTube, my Bella lift procedure. Okay. And lastly, also Sculptra builds over time. Hold there. And silicone, although I would never suggest silicone to a young person. So now what we're going to do, this is my final favorite touch, is we're going to have him bite down. Let's take a look. Bite down for me. Look at the width. You can see where some of the areas are wider. Turn a little this way. Great. We don't want to go too much wider, but we are going to move back just a little bit. Okay, so we're fine tuning. Bite down again. Great. So we got some good width there. Nice 90-degree angle. Turn a little bit this way. Really following that angle. I'm doing little deeper injections now to fine tune it. Okay, let's switch. Let me see. Bite down again. You take a look when he bites down. We're really honing in on fine-tune this side of his chin. The other side again. Bite down again. Really good. Alright. This is a pretty big improvement. Come hold here for him a second. I'm going to finish this last little drop on the other side, and then we're going to do an Emer reveal. You guys know Emer reveal is coming. Sure, now I haven't had an Emer reveal where someone didn't like it, so let's hope, let's pray that he does. All right. So now let me clean, hold on. The key, you guys, double cleansing, always double cleansing. So right now we're using a little alcohol. We've already wiped him many times. We're gonna clean off his lip. We're gonna clean off the chin. We're gonna clean off the other jaw. Now he wants over accentuated a little bit at the beginning. We really want to define that 90-degree angle. It's gonna I always tell people it's gonna look a little lumpy bumpy. Radiesse you can feel. It's a thicker filler. But now we've sculpted and defined, sorry, it's the alcohol. We've done his under eyes. Okay, I'm just making sure everything's nice and smooth. All right, so let's do it, guys. Emer, reveal. Give him the phone. Give him the phone. So what does he think? What were you looking to achieve?
More defined jawline, filler lips, of course, and then just overall.
Why did you want fuller lips as a man?
Well, just because the upper lip is kind of smaller when I would smile.
So smile a little bit, be a little bit bigger, and then show them, look straight and bite down. Show them the jaw. Show them these angles here. Exactly, when you turn to the side, have them see. We didn't even do anything to the cheek, but notice the under eye and temple area make the cheek look defined. And when he's looking at himself, he looks good. Don't look at me, I didn't do the filler. I'm the one that's not chiseled, you guys. Look at chiseled, now go to me, unchiseled. Chiseled, unchiseled. Okay, so now we're gonna flip back and we're gonna do regular reveal. So let's flip it back. Okay, so now give him a regular reveal. Let's bring it up. And now looking in a regular mirror, not anything filtered or Instagrammed, what do you think?
It looks amazing. It's perfect. Just what I wanted.
Great. So we got a really successful male facial sculpting. And again, remember, we've tweaked this over a series of treatments. He really isn't going to need treatment for a while now. But, you know, people get greedy. They see a little bit that they want tweaked. We can always add. But it's very hard to subtract, except for the hyaluronic fillers like his under eye, which we can dissolve much more easily. The radius you cannot. So you want to do it slowly over time to get the improvement that you're looking for. He's been Emerized. Bye, guys.